Dear audience, dear chair, let me introduce you my PhD, which is Dental Management of Children with Special Needs. Unfortunately, 60 to 80% of children with neurodevelopmental disorders have high anxiety and bad cooperation, resulting in general anesthesia for a regular dental treatment. As general anesthesia can result in complications and can prolong treatment, there is a strong need for some non-pharmacological interventions to decrease the necessity of general anesthesia. In this systematic review and meta-analysis, we showed that both cooperation and anxiety levels can improve by 11% with the help of these interventions. So therefore, dentists should consider implementing these techniques as part of routine dental care. Later, randomized clinical studies with stronger outcomes should be done to elevate the effectiveness of these interventions. And the grant committees should allocate financial resources for such studies in the future. After these 60 seconds, let me introduce myself. My name is Lili Rozgonyi. I'm a pediatric dentist at the Department of Pediatric Dentistry and Orthodontics. And my vision is that all children in special care are smiling. And to achieve that, I would like to evaluate the effectiveness of alternative dental management in case of these children. I have 3 specific goals and 3 ongoing projects. All of them started last year autumn, and the 3 aiming to investigate the dental management of children with special needs. Let me move on my first project, which is investigating the effect of alternative audiovisual techniques and dental environments for children with neurodevelopmental disorders. Neurodevelopmental disorders are increasing globally in the 21st century, affecting 53 million children under 5 years. These children are more vulnerable for oral health diseases, where 60% of children with autism have dental caries. Oftentimes, they require general anesthesia for a regular dental treatment, but this is not always necessary, so there is an unmet need for some less invasive calming technique, leading us to investigate alternative dental environments and audiovisual techniques. Our aim is to identify the best alternative audiovisual technique for children with NDDs. Our clinical question is that what is the effect of different audiovisual techniques and dental environments on dental management in children with NDDs. We use the PICO framework, and we hypothesize that the use of audiovisual techniques are superior to conventional dental practice. We've conducted our systematic search on 10th of November on 5 databases, and with the help of my co-investigator, we could narrow down the number of eligible articles for quantitative analysis to 20. So let me show you my first figure, which is about the standardized mean difference of cooperation levels in children with neurodevelopmental disorders during different dental treatments. Investigators in 6 studies measured the cooperation during the dental treatments using the Frankel scale. 5 of them used the Frankel scale, and 1 of them used the cooperation scale, which was converted into Frankel scale. Frankel scale is the most commonly used cooperation scale in dental field. This is a 4-point scale from 0 to 4, from definitely negative to definitely positive behavior. One of the studies were cross-sectional comparative studies, and 4 of them was crossover comparative studies with 402 patients. The heterogeneity was moderate with a y-squared of 70%, which can be due to the different type of NDDs and the different dental treatments. The overall effect was 0.46 standardized mean difference, meaning that this is an 11.5% increase on this corresponding Frankel scale. In the next figure, I would like to show you the anxiety levels, which was measured during dental prophylaxis. Anxiety is one of the most common reasons of a failure of a dental treatment in case of special needs children. We pulled data from 5 studies with 128 patients. 2 of them were randomized control studies, and 3 of them were crossover studies. The heterogeneity was moderate, and the overall effect was minus 0.6 68, a standardized mean difference, which is clinically relevant, a statistically significant result, and this is an 11.3% decrease on this Van Ham scale. As a conclusion, we can say that audiovisual interventions improve cooperation and reduce anxiety in children with neurodevelopmental disorders. Therefore, dentists and dental staff need training how to use these interventions, and targeted interventions should be done based on the type of the NDDs, and later, larger, well-designed randomized controlled trials with stronger outcomes, which are patient-centered, should be done. This is the progress of my first project. We are currently at the manuscript writing phase. Let me move on my second project, which is investigating the effectiveness of visual oral health educational techniques for hearing-impaired children. Hearing loss affects 34 million children worldwide. Sign language and lip reading are the gold standard communication for these children. Due to communication barriers, they develop high risk of oral health problems. There is a significant difference between hearing-impaired and non-hearing-impaired children's toothbrushing knowledge. Maintaining good oral health is essential for physical health and well-being, because if a child has problems with his or her teeth, he or she can have difficulties in eating, sleeping, concentrating, so we have to do something against it. Educating children has been a vital part of preventive dentistry. Therefore, there is a strong need for visual oral health education for hearing-impaired children. Our clinical question is that are visual oral health education techniques effective in improving oral health in children with hearing impairments? We are investigating alternative visual oral health educational technique and comparing to the gold standard communication to sign language. And we hypothesize that hearing-impaired children receiving visual oral health education will have better oral health indices. Clinical implication is to make dental health lessons more accessible for hearing-impaired children, leading to less invasive dental treatments later. In my third project, we are analyzing data from Eurostat database, and we are investigating the access to dental care services for people with disabilities in Europe. Approximately 1.3 billion people live with a significant disability today, meaning that 1 of 6 in world population are disabled. Patients with disabilities should have equal access to quality healthcare services, including professionals who are trained to address their specific needs. Because of the focus on their disability, other major diseases, or limited access to oral care, they cannot maintain proper oral health. Our aim is to investigate the possibility of providing dental services to patients with significant disabilities. Our clinical question that do people in Europe with a disability have a lower chance to go to the dentist compared to non-disabled people, and we are looking for the unmet need for the dental examination and the main reason for this dental need. And we hypothesize that people with disabilities have less frequent dental follow-up. The clinical implication is to establish a system where patients with disabilities have easy access to dental health care. As a summary, these are my 3 projects that I am working on, and I am planning to submit the first one this September and the third and second one next year. Let me end my presentation with a quote from Stephen Hawking: "The greatest enemy of knowledge is not ignorance, it is the illusion of knowledge." Thank you for your attention.
Thank you for your presentation, and some questions are here.
Congratulations. This is not the first time I hear your presentation, but today the picture on your background slide related to your very first project really catched my attention. And there is a purple light show on the fence in a dark room. And can you please describe what's going on? The paper, is the dentist supposed to work in a dark environment? Or can you please tell me more about this picture?
Yes, actually, thank you for your question. Actually, this is a picture of a sensory adapted dental environment, and the answer for your question, yes, the dentist should work in a dark environment, but the dentist can use a headlight, so then he or she can see.
Wow, thank you. Okay, Agnes?
Congratulations on your presentation. Could you mention some strengths and limitations of your first study?
Thank you for your question. The strengths of our study that we are investigating a different type of non-pharmacological interventions across a broad range of the different type of neurodevelopmental disorders. And we also use the robust methodology as everyone here. And as limitations, there are only small sample size studies and a very small number of studies regarding the different type of NDDs. And unfortunately, most of the studies focused on children with autism. So that's why.
Thank you.
Other questions from the audience? Dorottya?
Thank you for your nice presentation. Can you tell us exactly what type of NDDs did you investigate?
Thank you for your question. Yes, in my study we investigated children with autism, children with ADHD, with children with intellectual disability and hearing impairment.
Thank you.
Thank you.
Other questions? If not, I have two questions. My first question is regarding to your second project. The oral health education will be better or more success if you involve the parents or the other caregivers. What is your opinion, or what are in the literature?
Well, I think yes. The answer for your question is yes, we should involve them because they also should know how to educate these children, not only the dentists.
And how need to communicate
yes,
these
how
children?
to need to communicate, yeah. Also.
Mm-hmm. And my second question is regarding to your third topic. Why do you separate the population under and over 15 years old people? Why is the 15 years is the border?
So these are questions from a questionnaire of this Eurostat database, and they are differentiating people under 15 years
but why?
I don't know the reason. Sorry.
Please check it.
Okay, I will check
when it. When you write the article, it will be important. Why that is the border.
Okay.